For the NT, the oldest Aboriginal health service, community-controlled health service, is the Central Australian Aboriginal Congress. They were established in 1973, so this year is their 40-year anniversary. Again, they started off from small beginnings like every other Aboriginal community-controlled health service. They now have a number of sites within Alice Springs. They employ well over 100 staff, and they're very well established in the Alice Springs community. They deal from a range of different services, from not only just a health centre, but also like men's, women's health, chronic disease, youth, alcohol and other drugs. So a very strong Aboriginal health service that everyone within Alice Springs is very proud of. From Congress's establishment in 1973, there are now 26 Aboriginal community-controlled health services across the NT. And again, they range from very small ones, particularly in the remote areas, to the larger ones. So like I've explained, the concept, why it's important. Like I said, Aboriginal people have always been too scared to go and address their health needs, and it still happens now. I know from my own personal experience with my family that especially my aunties and uncles, they don't understand, you know, the health problems that they're dealing with, or what's even actually happening to them, even with having a health issue themselves. There's been experiences of going to GP practices, to the hospital, where they're met with services that are no good for them. They come away feeling no good. I had an auntie who had a stroke, and she went to the hospital. This was about 15 years ago, and she went to the hospital slurring, half her face drooping, and they treated her like she was a drunk. And then she walked away thinking, well, they don't want to help me, so there's nothing I can do. It wasn't until a passerby thought, no, this person's not drunk, she actually needs some assistance, that she actually got seen. So that's an example of somebody not understanding what's going on with them, with a stroke, going through the symptoms of a stroke, but then your own reception or medical staff actually thinking, oh, just another drunk that's come in, she can just sit down and just sleep it off. Another thing around Aboriginal community-controlled health is, like many other Aboriginal families, my families have a lot of chronic illnesses. A lot of it's pretty much being perceived as being genetic, so a lot of my sisters, brothers, cousins are all expected to get diabetes at some stage in their life, high blood pressure. My sister is, before 30, has high blood pressure and is pregnant, has gestational diabetes without being a drinker or a smoker. And it's frustrating for her to see others that are drinkers or smokers not having other things wrong with them and wanting to know why them, sort of thing. So it's I suppose this is why I'm within the Aboriginal Community Controlled Health Service, because I believe in it. I've seen some great stuff come through the sector, and having my own father and my uncles and aunties go through strokes, through cancer, through heart attacks, for them they still don't understand. Like, my dad had a stent put in his heart, and I don't know if anyone's heard of the education tool called Ibera. It's an education tool that visually shows you as like a video of how they actually do something for you. So there was one component where they actually show how a stent is put in their heart. And he'd already had this operation a year and a half before, and it wasn't until he watched that video that he went, oh, he stood there just watching this thing happening. I was like, what's wrong? And he said, I still, to this day, didn't know until now what they'd done to me a year and a half, 2 years ago. So it's amazing that even though you've got your patient and you're explaining and you're going through a number of consultations and seeing a number of doctors to explain what they're about to do to you, it's actually quite amazing just that they don't really understand or know, because they can't see. I'm a visual person, like my dad and aunties and uncles. If they don't actually physically see what's being done or how it's to be done, they really don't understand. Again, it goes on about oral and written histories documenting ongoing distress and mistrust felt by Aboriginal and Torres Strait Islander people towards service providers. It's still an issue today as well, because of the fact that now that we've got this initiative of chronic disease and we're trying to provide holistic health care, you want to link them into specialist services, Sometimes there's waiting periods for specialist services. Sometimes they don't know what doctor's what or who they're seeing next. The great thing about going through an Aboriginal Community Controlled Health Service is that a lot of the times you have your healthcare team, and that the importance of Aboriginal health workers being there ongoing to be able to maintain that patient relationship, to be able to help understand that person, their community, their family needs, to be able to make sure they continue to understand what they're going through, to be able to explain things that they come back going, look, I went to this doctor and I don't even know what I went there for, to be able to build that relationship with them so that they know, so that you're taking that journey with them.